I like the way that she can communicate with the patients and makes it like complicated scientific stuff and medical stuff. She is able to communicate it in a way that I know the patient is understanding. She's very clear. She just communicates really well with them, and I know that they understand me. You can tell on their face they understand really well. And the way she treats them so respectfully, and she's always smiling at them, and she exudes like enthusiasm. The patients I got to do surgeries on with him were Project Access patients, which is a program in Wichita where patients who don't have any insurance or any funding can apply, and they can get surgeries they need, or if they need to go see an endocrinologist or anything else, they can get that specialty care for free. And so I was asking him about that and how often he does it, and he said that when he first got to town, he didn't set a cap on it. And so it got to the point where he was seeing mostly Project Access patients. And so then he set a cap to 2 a week, which means that he's seeing roughly 100 Project Access patients a year.
I first met Dr. Lemaster about a year and a half ago at the International Medicine Cross-Cultural Conference. And he was giving a talk about healthcare for Bhutanese refugees. And I went up to him afterwards saying, I had a Bhutanese patient, I felt clueless, can you help me? And he said, sure. And then I said, I would like to do a Clendenin Fellowship, can you be my advisor? And he said, sure. He comes across as so peaceful and present with his patients and makes them feel like he has all the time in the world for them right there. And also as a teacher, his standards are very high, which can be intimidating, but he's very patient with questions and very helpful.
And the patient was sitting in the bed, and she just cried out, I don't want to die, I don't want to die, it's not my time. Dr. Howe ran over and sat with her on the bed and held her hand and explained to her that this was very severe and that it's something that really could take her life, but that we were going to do everything in our power to keep that from happening. And she gave her Kleenex and held her hand and just let the woman cry for a couple minutes. And then when she kind of come back to baseline, we went out in the hall, and Dr. Howe divided up tasks, and we went about trying to get this woman healthy.
So Dr. Taylor offers a lot of valuable lessons for those of us going out to the career and training to be future doctors. She's always had the compassion of showing she's always showed patients the compassion that she would want to be shown. She always has a smile and friendly gesture towards the patient, as well as a warm hug for those who need it. She seems to know exactly what the patient needs when they come in, regardless of where they are in their treatment, to kind of help them move along and get the most out of their care that they can, and still remember that someone does care about them and is worried and concerned for their health, more from just the medical aspect, but also just a humanistic aspect, making sure they're doing okay socially, as well as taking care of not only the patient, but their entire support group. And commonly she asks about the caregivers and the family members, the husband, the spouse, and the kids, how they're dealing with the illness and what she can do to help them out.